So I'm going to start by just setting the stage. And what I want to talk about in this session is what is happening to a woman as she's progressing through different life stages as she's aging. And how are those changes connected to how a woman is feeling day to day? So, my first question is actually for Dr. Norris. Dr. Norris, over the course of a woman's life, what are the common medical challenges that women experience that tend to catch them off guard?
The first thing is the question of common medical issues. Actually, perimenopause is a normal issue, and we've medicalized it. And what we're really trying to do moving forward is get away from that. And the most interesting thing to me when I started to delve into this literature, and I have to tell you that I was always doing women's heart health and heart health research, and was lucky enough to get the Caverson chair, and they said, yeah, you can do your women's heart health, but we need to look at perimenopausal midlife women's health. There's nothing in that area. So I started to dive into it, and my background was nursing, and then I did a degree in epidemiology, but I was going back to my notes of what happens in your period because I couldn't remember it, and it didn't, estrogen goes up, progesterone goes up, so what? This is how you feel, this is what happens. And as I started to go through it, I started to discover that we've always just looked at estrogen and progesterone as the reproductive, either you're trying to get pregnant or you're trying to not get pregnant, and we manage it that way. And in fact, the paradigm shift for all of us, and you especially, because of the age that I see here, is that actually estrogen, or we now say the ovaries, because they produce the estrogen every month, the ovaries are the architects of all your health. So I have a couple of diagrams here just to let you see. These are the 400 estrogen receptors in your body. They are responsible for your brain health, your heart health, your bone health. They're responsible for our health. And because we've always just thought it was about reproduction, we haven't paid attention to what estrogen is doing. In a woman's body, their follicles, you're born with the number of follicles which will produce an egg every month. And so you're born with the number, which was really a cool concept for me because I was thinking I was already in my mother's uterus when she was born. Like, think about that. She had the ovary, she had the follicles that she was going to have for the rest of your life. And it's like a gumball machine. And every month, 20 of them try and get out. And you keep decreasing that gumball machine. But at 30, at your late 30s, we start seeing a decrease in estrogen because the follicles produce estrogen for you monthly. And we call it endogenous, the estrogen in your body. And so long-winded answer. But it's important to know that at late 30s, your estrogen starts to decline. And so when you hit 40, you'll start to experience symptoms that are related to that estrogen decline. And the first one that women that age are talking about is, the Seattle group has named it not feeling like myself. And you get brain fog, or you start forgetting things. Or the other thing is really increased anxiety and increased irritability. And it's in your 40s, and if you talk to your friends, and I went through it, the thing is that we don't recognize that that's part of our natural process that's happening. I went to a physician at 42, and I said, I think I'm going to kill somebody. Like, I was that angry and irritable all the time. And she said, has your cycle changed? I said, I'm 42. And she said, oh, then it must be stress. Let's try an antidepressant. And the sad thing is that's what's happening today. It is not necessarily stress. Stress has a component in that. I have to tell you, between 40 and 50, it is the most stressful time of a woman's life. Everything is going on. And likely you're in a level of stress, chronic stress, because you're trying to juggle all the roles that you're playing. And the estrogen, the brain prioritizes the production of cortisol, which is what starts flowing when you're under stress, over estrogen. So the brain is saying, not a good time for you to be pregnant. We're just going to pump out the cortisol. You're not going to get follicle-stimulating hormone, so you won't produce estrogen. You need that estrogen for your brain to function. You need it for your heart to function. You need it for your bones. It's essential. This is an essential part of our health. There was a study done in early 2000 where we all got scared off hormone therapy because of the risk of breast cancer and cardiovascular disease. Those have been totally debunked. The science was not good, and you actually need estrogen for your heart health and your bone health. And I think we need to stop listening to the woman's health or someone saying, I have breast cancer, so I can't be on it, or my mother had breast cancer, I can't have estrogen, because it's not true. And the estrogen is different these days. It's called biosynthetic. It's exactly the same stuff as we produce in our body. It's been approved by Health Canada. It's in dosages that we can increase and decrease. In the old days, estrogen was one size fits all. So, who knew whether it worked or not. So we're in a perfect time for women your age or the women you love, or telling your friends that it is necessary for us to start looking at our estrogen and progesterone as you're going through this stage of life.
My next question is for Dr. Mithani. In your practice, and we know you work in the emergency room, what are the signs that women often dismiss that they should actually be seeking medical care for?
So the big one that I see in women in particular, and we kind of know this with the research that Dr. Norris and her team are doing as well, is heart-related conditions. And so when we look at like a medical textbook, the way that, I was taught in medical school, in nursing school, it's the classic like chest pain, clutching the left side of your chest, as like the symptoms of a heart attack, but those present differently in some populations, women being one of those, people with diabetes being another population, where the symptoms tend to be a lot more vague. And so at a time where estrogen is decreasing, where your cardiovascular risk goes up, also at a time of high stress, like in your 40s and 50s, these symptoms can be things like fatigue, like who's not tired, right? So fatigue, feeling off, not feeling yourself, maybe having like a little bit of shortness of breath. And like these are symptoms, not sleeping well. These are symptoms that all of us just experience in the stages of our life anyway, right? And so they're ignored, they're dismissed. And unfortunately, they are often not picked up by healthcare professionals either, because they're, just chalked up to being busy or stressful. And so that is a common presentation for me, where somebody has these vague symptoms that aren't like the classic chest pain, shortness of breath, and end up having a missed heart attack. And we know that for heart health in particular, time is muscle. So the longer you wait to get an intervention for your heart attack, the more your muscle dies. That means you have a higher risk of death and a higher risk of morbidity from that. So like it will affect the function of your life thereafter, because there was delayed care that occurred. And so that, for me, that's like a big, hopefully, take home for the audience, that like these vague symptoms should not be ignored. Listen to your body. You know your body the best, better than anybody else. And don't be afraid to advocate for yourself in those situations.
Dr. Mithani, I'm going to go off script a little bit, but, given that you said, these symptoms are often dismissed by healthcare professionals, I guess, how should women go about approaching those conversations where you just kind of know something's off, but you're not getting that sort of response that you would expect from your healthcare team?
So bringing someone with you, if you're able to help you advocate for yourself. If anyone has ever been like in emergency care in particular, it is chaotic. Not only for the patient, but like for me as a physician as well. There are so many competing interests. And so a lot of times there are situations where you and your physician might be talking past each other. And so having an additional person in that room with you that is like listening to the conversation, that can fill in the blanks for you when you're not able to, you're stressed and trying to just get the information across. So being there, writing things down, coming in with questions, coming in with a list of your symptoms, these are all things that can help you advocate for yourself, because it really is, like, I've been to the Emerge myself. It is hard to remember to say the things when you're there face to face. And then just using phrases like, something doesn't feel right. This is not something that normally happens for me. And naming it. I am worried about my heart. Saying that will then potentially like flag for your physician, okay, maybe this is something I actually have to think about. And it's a simple test. It's a blood test and a heart tracing that can very reliably rule out a heart attack. And so even just naming it, I am worried about my heart, that will change the framing of the conversation.
So my next question is actually for both Dr. Norris and for Melanie. So, and Dr. Norris, you started the conversation about menopause, and we're hearing more and more about that. So, can you maybe elaborate on how our understanding has evolved? You talked about hormones already, talked a little bit about women's health study. Is there any other things that you want to share with us? And how do you reassure a woman as they're going through this phase of their life?
Thank you. Great question. I want everyone to know that menopause is one day of your life. Menopause is when you've gone 12 months without a period. That's menopause. You're either premenopause or you're postmenopause. So when we all talk about menopause care, I think we need to change the narrative on that. And so you must have heard of perimenopause care. We also called it post-reproductive care. So when you're done having babies, things are changing as far as your body is concerned, and that's what we're trying to say. These are natural changes. We aren't our mothers going through menopause anymore because we have different environmental influences and different things going on in our lives. So the whole conversation has to be about how do I enjoy this passage rather than, oh my God, she's going through menopause, or, I'm having a hot flash, or things like that. And I think it's by knowing what's going on in your body, knowing that this is happening to every single woman in the world around their late 30s. The estrogen starts dropping off. If you're experiencing symptoms, you have every right to go in and you say, I think some things are changing. And we do not have a blood test for it because estrogen and progesterones are so volatile depending on where you are in your cycle and who you are. But the symptoms are a sign. We are now saying as a clinical sign that you're in perimenopause. If you're constantly looking for words, like trying to figure out what's going on in my head, the McKinsey study did a study on looking at this, and it says $37 billion every 5 years is lost in Canada by women dropping out of the workforce because they think something's wrong. I can't do the stuff I used to do, and I'm looking silly in these board meetings, or they're having symptoms and having to leave and saying, this isn't, I don't want to feel like this at work. Don't quit work. You're at the best time of your life, and we can help you manage your way through this, absolutely. And it's just women, your advocacy point is so valid. And one of the things in our studies that we determined in the heart health studies is that men do better if they're married. Women do better if they have a friend or daughter as their social support.
Women do better if they have a wife.
Yeah. Yeah. So the point of that is it's really important to bring, I've called it your posse, bring someone in with you, because then they can ask all the questions they want and you don't feel like you're overstepping or you're questioning the doctor. So the friend says, that doesn't make sense to me. It's not that you're being offensive to the physician, right? Like, it's really hard, even knowing what I know, to go into the emergency department and say, do you think it could be? Like, could we do this test? And then I've insulted this person in front of me. So you bring a friend in with you for whatever you're going, even if you're going for perimenopause care, and you say, yeah, we went to a talk and we would like to talk about it with your physician. And that support really, really helps.
Dr. Norris brought up a really important point that I don't want to be glazed over. There is no blood test for perimenopause and menopause. Like, please let that sink in. People will try to sell you those tests and charge you a lot of money for those tests. There is no blood test to say yes or no. It's a clinical diagnosis.
Yeah, thank you. When I think about the last part of your question, Margaret, was around reassuring your patients. So maybe that's your friends, your colleagues, women in your life. I think there's two really important things to take away, and I think you touched on it when you were saying the advocacy in the emergency room. As humans, we have a really strong tendency to not want to bring attention to ourselves in a way that could be judged. And I think if you're speaking to a medical professional, you're speaking to a friend, we tend to minimize our symptoms in a way because we're afraid that will be judged in some fashion. But I think the second part is that you have to trust your gut. And women especially will put that voice to the back of their head and sit with that fear and be up all night, and you're really not taking action on the thing that's really causing you some significant stress. So Don't be afraid to advocate for what you're feeling, what your symptoms are. Bring a friend, write them down, and you will never regret going to the emergency room for something that's ruled out as negative when the consequences could be the opposite. So please don't ever.
The important thing you said there too is we discovered in our women's heart health studies that women don't use the word pain. They have a chest discomfort or a burning, and I took my mom into the emergency. I was talking to the nurse at the bedside, and she says, well, unless they say chest pain, they don't get into the chest pain protocol. So if you say, I just have this crazy discomfort or burning, in my chest, or my arm is hurting. The other thing about women for heart disease is that women consistently have 2 or more other symptoms that are happening at the same time. And I was talking to my sister, actually, and she said, I just had this strange, she said, like my shoulders were really hurting, but I thought it was because I did this. And then I was short of breath, but I'm so out of shape. She's describing what's a heart attack, right? Like it's not just that you have the chest pain. You will have something going on in your chest. There's 2 other things that you can't sort of connect. Nausea and vomiting is common. Fatigue. But when we're talking fatigue, it's the kind of tiredness, because like you said, we're all tired. It's the kind of fatigue where you have to sit down when you're making the bed. And I remember that when I was pregnant the first time. Like I just said, boy, am I tired, and I'd have to sit down. And I just think the body's so clever. It's saying, sit down and take a rest. You need that right now. But women don't use the language that we need to use. So you do have to advocate and say, this is a pain. And I remember telling my husband in surgery, I said, they're going to come to you and they're going to say on a scale of 1 to 10, what's your pain? You say 12. Because you need the pain medication so that you can get up after this surgery and start moving. That's the best thing for your health. But don't say, well, it could be a 2. They're going to say, why are you wasting time in our emergency? Even though it's important that you get seen.
So I'm actually turning the next question to Dr. Mithani. So there is so much information out there about perimenopause, women's health. So if we are to go and look for sources, how do we figure out where to go for those reliable evidence-based guidance that we should all be looking to seek?
Don't go to social media first, please. Unless it's my page. So there are a lot of really great national organizations that have a wealth of information. They're all websites. So yes, you can go on the internet, just don't go on TikTok or Instagram to start. So the Society of Obstetricians and Gynecologists of Canada, SOGC, Health Canada has excellent information. Heart and Stroke has excellent information as well with a specific, they actually just developed a women's heart health tool. That's a questionnaire where you can basically help do a risk assessment for yourself, with a focus on women. So start with the Public Health Agency of Canada is another good one. So start with the organizations first, because that is where you can find credible evidence-based medicine. And a lot of times, websites seem like a thing of the past. It's not really where people go to first. It's certainly not where I'll admit, it's not where I go to first either. But it's a very underutilized resource, especially because these organizations have so much funding going into making sure that the public has accurate and reliable information. Consider ourselves lucky that we're not in the US where that reliable information, for example at the CDC, it's not reliable anymore, right? And so we're so lucky to be able to have money and funding continuing to go into having reliable information. And then the second part of that is if you do come across, all of us scroll social media, right? So if you do come across health information, or if you do go searching for it, just stop and pause and make sure that you're evaluating the information with a good lens, right? What are they telling you? Does it sound like a quick fix? Probably not a good idea. Then are they trying to sell you something? Ignore it. Go to their profile, check out what their credentials are, and then still ask yourself, is it too good to be true? Because unfortunately, we're now entering an era where misinformation and disinformation is not just health and wellness influencers. People with credentials are also putting misinformation, trying to sell you a supplement or a protein powder. So approach with caution. If somebody is trying to sell you something, it is probably not as accurate as you think it is.
We have a website. You got these cards in your bag. And it's yegwomensresearch.ca. And we are curating all of the evidence for midlife women. And we are going to launch a program called Aura, you'll see it in late June, that has videos and resources, and they're all evidence-based for women going through perimenopause. And we also have opened a virtual online clinic for women going through perimenopause, and we're trying to prove to the government, it's MP-led, we want to say this is a service that should be publicly funded. And so that's the other card in your, but the point can't be overstated about it. Right now, perimenopause is the golden goose of marketing. It is, everyone is in there saying, I've got the cure for you. And you really have to take a step back and say, you know, if it was that good, wouldn't we all be on it?
I want you to share some real life examples with me. And so the example that I'm looking for is, can you think back in your career of an example where early action by a woman actually had some really positive impacts on their outcome? And maybe that's many patients of yours, but maybe we'll start with Dr. Mithani and then Dr. Norris.
So I gave the example of cardiovascular health before. That is something that comes in a lot from an emerge perspective of, you know, listening to your body. Please always listen to your body, and like going in knowing something's wrong. Another example that comes to mind is postmenopausal bleeding, right? So this is not something I think that we talk about enough, where you should, like, once you hit the 1 day of menopause, right, at the 12-month mark, you should not have bleeding after that. And a lot of, because it's not, like, women's health is still an evolving conversation where it's, you know, still a bit of a taboo topic to talk about, like, to your point, a lot of people don't know that that's not supposed to happen. So postmenopausal bleeding is like cancer until proven otherwise. And the earlier with cancer, the earlier you intervene, the better the outcomes are, and that basically it will have, like, it can be treated and have no long-term effects on your health after that. So many, many women have come in the emerge understanding that postmenopausal bleeding is not okay. They come in, they get the testing that they need, they get the follow-up that they need with the endometrial biopsy, and then they have significant positive outcomes after that.
I think for me, it's been this journey. We've been working for a year to get this clinic, the virtual clinic, up and running. And I've been stopped in different places by people that have been at the clinic. And the one thing about our clinic is the first visit is 50 minutes long. And so I've had women that say it's the first time I've been listened to in my whole life. And reviewed, it's not the 10 minutes or the 15 minutes that you get. We really want to figure out where you are at as a person in your health and how do we move you forward. But I've had girlfriends and younger girlfriends, obviously, but that go on estrogen and have had the brain fog or the irritability or the anxiety. And one of them said to me the other day, she said, it was like I woke up and I was back to my old self. And it was the strangest feeling she'd ever had. But it's just, like I said, the first place that it goes is your brain. And so things don't seem right and you know it. And it's to see that and to think that, you know, we've been depriving women of that, depriving women of having a healthy transition and to enjoy life. You're at the height of your game. You're doing everything you always wanted to do. Like, you want to do it with a quality that you're enjoying what your life is all about. And to be able to do that is just overwhelming to me.
I'll just add to that, the work with that clinic, I just want to give Colleen a shout out here, because, like, if we could have access to more publicly funded, where the user does not have to pay women's health, all of us would be better off. And as much as, like, in the emerge, I would love to spend 30 minutes, 40 minutes, like, the system does just not allow us to do that. We can't do it. I want to. Family doctors the same way, we want to be able to do that, but right now that's not a priority. And so the more that we have projects like this, the more that we have your voices advocating for that, the more the system can change so that the physicians in it, the nurse practitioners in it, we want to provide that care for you, but we can't right now. So
I actually want to turn this away from a little bit of the medical, because you know what? This is a normal transition of women, right? So let's talk about the good with these changes. I'm going to open it up to all of you on the panel. I'd like you to talk to me a little bit about some of the life experiences yourself or your patients, and what has been positive for women as they're going through these milestones, as they're aging? The fact that we're aging is a good thing because the alternative is not good, right? So, Mel, do you want to start?
Yeah, thank you. I really appreciate this conversation because one of the things that I made in my notes was about how do we normalize the weird? Because this isn't weird. This is so normal. And how do we have conversations with each other? Let's bring this to a workplace setting to say, we're all going to go through the same thing. It's not a matter of if, it's a matter of when. And so we instantly have this great connection and bond between this experience, and we can learn from each other and grow from each other. And it's really through those conversations and that peer support that is really, really important. And so I believe what you just said, Margaret. This isn't something I have to go through or something I have to endure. I get to. And that simple framing in your mind completely changes your experience about going through this many years of change and many years of trying to figure out why I put the milk in the pantry and the cereal in the fridge, because I did. So, and
We've all done that.
You know, I was like, all right, little check in here, see where we're at. But I get to go through this, and I'm proud to be able to get to go through it. Because some people who are dear and near in our life, we've lost them, and they've passed, and they haven't had this experience, and I get to.
Yeah, I want to build on that actually, because I mean, look around. Like, how great is it that we're able to have this conversation be an important part of our lives together, right? And so this is a topic that has not been talked about in the past, but we are now at this moment where it is finally getting the attention that it needs. We get to be there at the front of it. And that means it has a direct positive impact on all of the healthcare that we as women are going to receive. And so it is giving us the empowerment to be able to advocate for ourselves, be knowledgeable about our health. We are finally getting women's health the attention that it has deserved for centuries. And we're finally getting to hopefully start to catch up from a research standpoint so that we can start having women's health focused research so that medicine can catch up to where it needs to be.
I'm actually reminded of, I was listening to a documentary on CBC, and it was about a little girl from Southeast Asia that moved to Toronto, and she moved just before her period came, and her sister had a big celebration when her period came, and they invited everyone from the community, and they had a great meal, and she couldn't wait for this to happen, and she moved to Toronto and sent out all the invitations to her classmates, and one of the mothers phoned of a boy and said, "How dare you?" But now we're doing that for girls, right? Like, so we can learn from those messages. And so that it isn't a whisper and what's happening in my life. You say, "Oh my gosh, I showered today and I lost a bunch of hair." Guess what? We can help you with that. Like it's not a secret. It's not a death sentence, like when 3 colleagues in Calgary went and got MRIs because they thought they had a brain tumor because of the forgetfulness and the things that were going on. They have the money to do that. But for the people that don't, they need to understand this is normal, and it's actually, we have a way of dealing with it.
I'm just going to add to that, so last night I was, we were driving my daughter home from her soccer game. She's like, "Oh, hey, Mom, my teacher's going to send you a form that you have to sign for my health class." She's in grade 4. My health class, and you just have to say it's okay that I can go to this class. I'm like, yeah, totally, absolutely, it's so important. And then use that as a conversation point of, yeah, it's really important for us to know about our bodies. And she's like, "Oh yeah, but they let us know that the boys and the girls are going to be together." I'm like, yeah, absolutely, because boys also we say women and girls, but boys should also learn about girls' bodies, and girls should also know how boys' bodies work. And so as much as this is a conversation from a women's empowerment standpoint, it's great to see men in the room here as well, because we need you to be our allies in this and also know about this as well. So,
thank you. So I'm going to actually now turn it over to Mel, because I want to talk about how can we get support in the workplace. And so Mel, what is the one simple way that employees can get started towards making any health or lifestyle changes?
I always get the one simple. I always get that question. So I think it's really important. One simple way is you have to start with awareness. You can't do anything and you feel absolutely stuck and lost without awareness. And awareness comes, I think, from two really critical sources. One, events like today. Events where you're hearing it from experts, you're not going down the doom scroll of social media. That's not a great place to find your information. But you're hearing the stories from other people. You're feeling validated in what you've been going through. You're building awareness that I didn't know this and this and this and this meant this. That is so critical. That first step of awareness is key. The other source of awareness that I think we sometimes minimize is that comes from loved ones, partners, peers. And I'll never forget, a colleague said to me once, I care for you enough to risk your disapproval in saying, I noticed that you're maybe not yourself right now. What a beautiful way to have a conversation with somebody, to say, I care about you in a way that I'm afraid may upset you, but I care about you enough to say it. That's when my husband comes up to me, he's like, the milk was in the pantry. I said, well, was it a whole jug of milk or was it just a little bit? Like, that awareness is important. So the simple way to get started, awareness. For employees, a really great source of information is on our public website, albertabluecross.ca. We have a women's health page there. So if you haven't checked it out, there is a menopause in the workplace guide. Please go take a read. It's excellent information. Please share it. It is on the public site. And this is another great way to build awareness and give you the tools and the resources you need to get started simply.
One simple way, she says. So many simple ways. Okay, I'm going to open this question up to the entire panel. And so, obviously, with Alberta Blue Cross being a benefits company and Mel sharing that, we've got resources around benefits. Beyond benefits, or maybe even benefits, what are some of the ways that really can help support a woman in the workplace? And maybe I will start with Dr. Norris.
Thank you. We're actually working with Blue Cross because the clinic had a soft launch in February, and as I said, it's a virtual online. We've seen a bunch of women, but what we're determining is that if it's their bone health that's an issue, there's nothing to follow up on, or if they need physiotherapy, there's, they have to pay for physiotherapy, or if they have sleep issues. We're trying to develop those resources, like with the help of Blue Cross, to say, this is a woman's package, right? Like it might be a one physiotherapy visit and they teach you the exercises for your pelvic floor to keep it strong. But it's essential for health. And maybe I don't have the $50 or $60 or whatever it costs. So when we develop things like this, we have to say, okay, it's not just the visit and the hormone therapy, it's the lifestyle stuff that you have to keep moving. So if your joints aren't working, then how do we get you moving? You have to eat the right foods, but how do you afford the right foods? So it's sort of talking about those issues. And like I said, we're trying to work with Blue Cross to say, how do we do this for women in the workplace? Because a lot of people, I have one of the best insurance policies, but it doesn't cover physiotherapy. It only covers 4 visits after a surgery. So, those sort of things. How do we make sure it's the right people doing the right thing at the right time?
So I'll add to that. I think from a workplace standpoint in particular, like first of all, having like a safe and inclusive environment, and this is a great example of that. And then from a benefits standpoint, I mean, like I have Blue Cross benefits. I'm in my 40s and I play tennis, I play ultimate frisbee, and like, boy, do I need physio more than I did before. So like I just got my hamstring needled this morning. So, I mean, these are all things to help support an ongoing active lifestyle, which we know is so, so important from like a cardiovascular health standpoint for women, from a bone health standpoint, for longevity. I mean, like the secret to longevity is like, just move your body, truly, right? Eat well, move your body, get sleep. There you go. I could charge you so much money for that, but it's here for free. So having programs to support those things, to be able to do it like during your workday, for example, or having support outside of the workplace to rehab, to have access to, the nutrition and fitness that you need. Like those are all things that are so value added from a life standpoint. I would love to see more employers be able to offer that to their employees.
Yeah, absolutely. That's a really good point. One of the major sources of support employees have in the workplace is their benefit plan. So what you need to do is log into your member site if you haven't for a while. check at your coverage. Not everybody chooses the same package. So, everybody makes different decisions based if they have, a spouse that has a plan or somebody else. But familiarize yourself what resources you do have available for you and what your plan covers, because you can start with knowledge and then build that awareness and then look to the resources and then look for those supports. And so if you haven't done that in a while, go take a look and reach out to us if you have any questions.
There are some common medical beliefs, and we're going to turn it over to the two doctors to tell us if they're actually true or are they just myths. Okay, so first one, you can ovulate without having a normal period. True or false?
100% true. Yeah. So I'll let Dr. Norris expand on this, but I mean, like, this is ovulation and periods are often together, but they are not always together. There are lots of conditions, like PCOS is a good example. In the perimenopausal period is a good example where those two things are not aligned. And so, you can absolutely ovulate without having a regular period, which is why birth control, if you don't want to get pregnant, is really important.
And actually, the birth control part is a really important part of midlife health too, because women will say, I'm on birth control, so I get my estrogen and progesterone, and actually that estrogen doesn't do the stuff that your endogenous estrogen does. That estrogen is to fool your brain that you're pregnant, so you don't ovulate and you don't develop your uterine lining. So it's important to discuss that and say, like, you do want to stay on some kind of birth control pill. Well, I guess if you wanted to get pregnant, it's not an issue, but at 45, a lot of women are confusing perimenopausal changes and pregnancy, and the last thing you want to do is think that you've done with kids and you're pregnant again. So pay attention to that.
Okay, next common belief is, or maybe it's not a common belief, perimenopause can last up to 10 years. Dr. Norris.
Absolutely true. And, it's too bad it's been given. Yeah. You get to. That's absolutely. Yeah. And enjoy it. But it is because it's the late 30s that it starts. So, and the average age of that one day of menopause is 51 in Canada. So,
hormone levels can fluctuate daily, not just monthly.
Yes, which is why hormone tests are not, like, don't waste your money on them.
Don't.
So yes, like, although, I mean, like, yes, there's, that classic graph of what happens. I know you have that. Thank you. Perfect. Yeah. So the classic graph of what happens, like, in general, like in your 28 to 36 day cycle, but especially as you enter the perimenopause era of your life that we get to enter, those fluctuations can be quite chaotic, is how I would describe this graph. Like, they can be quite chaotic, and so that can explain things like the symptoms that you start getting, the difficulty sleeping, the vasomotor symptoms like the hot flashes, the brain fog, changes in your cardiovascular risk, changes in your bone density health. Like, these are all things that are explained by these hormone fluctuations that stop to kind of occur in that predictable pattern.
Okay, waking up consistently at 3 to 4 a.m. can be linked to hormonal changes. True or false?
absolutely true.
Okay.
So there's two things with that. It's either you can't fall asleep or you wake up at 3 and can't get back to sleep. And for the longest time, women have been told it's perimenopause and you'll get through it. And no longer, because I'm going to give you some statistics, but sleep deprivation is related to the first one. I was listening to a neuroscientist talk about why we sleep and direct relationship between sleep deprivation and dementia. And 2/3 of people who have dementia are women. So you don't think it might have to do with the sleep deprivation. And the other statistic I was going to say about, sleep is related to heart health. Like, because if you're not sleeping well, your body goes into an inflammatory process and all sorts of things start to happen. And so we really need to pay attention to that.
I'm feeling really good about being a shift worker right now with all that new data that's coming out. The only thing I'll add, so yes, but there are other things that can affect your sleep as well. And so it is important to think about how late in the day are you having caffeine? Like, what is your sleep hygiene like? And these are all things, especially in that 40 to 50 age frame where we are like busy professional women that have all these things on the go, there are other things that can play into sleep in addition to this.
No, and you need to.
Yeah, absolutely. And don't underestimate the value that moving your body in your day plays to your sleep. It is critical. Try a little experiment for a while. Do some activity, light, 20 minutes, a light walk, and monitor your sleep for the following days. And then when you stop doing it, monitor what happens. There's a significant link between you getting the right amount of activity in your day and your quality of sleep at night that doesn't rely on medication. It's a really effective way to help with your sleep.
After menopause, a woman's risk of heart disease can equal or exceed a man's.
Absolutely. So that protective estrogen is dropping off quickly, and that provides cardiovascular benefit and protection in our reproductive years. And so once that goes down, the risk of cardiovascular disease shoots up significantly in women. And that's why it's so important to, first of all, understand that, then be able to talk to your healthcare professional about how HRT can benefit you from a cardiovascular risk standpoint, and know the symptoms to look out for.
There are studies that demonstrate that the women that have vasomotor symptoms, hot flashes and night sweats, like really significant one, 12 times a day, already have levels of cardiovascular disease in their vessels. And so that's why it's really important to start thinking about estrogen before you get to that. Because if you can get through that phase, you can taper off your estrogen and your vessels have survived the change.
You know, I think I've had questions from colleagues where they were nervous about using hormone replacement therapy because they have heard that, it can cause cancers and strokes. So can you elaborate a little bit more on that belief and whether it's true or false?
It's false, and as I mentioned, the Women's Health Initiative was the first. We were very excited about it because it's the first clinical trial looking at HRT and non-HRT. But the problem was with the sample that they used. The average age of the women were 63 years of age, so they were already well into menopause. And we do know that you shouldn't start on hormone replacement therapy after 60 years of age or within 10 years of menopause. So we've got a big window there that we can still use it, and it's really useful. That was one of the issues. The other issue is they didn't do any studies to determine if the women had breast cancer or not, because it takes 7 to 8 years for a tumor to develop. So we didn't know if they already had the tumor in them when they started on the study, which really, it changes the results. But the worst thing about that study is they went to the press before they went to peer review. And they reported on things that were not statistically significant. And in our world, as an epidemiologist, I would not report to you that there was a difference if there wasn't a statistically significant difference.
Yeah, I mean, that study is such a disservice to women's health, unfortunately, and the misinformation that lingers on from it is still felt today. And, another good example is the MMR vaccines cause autism. Why are we still having that conversation, right? When there's poor research that's done like that, it has significant impacts on, decades later, in terms of, positive health outcomes for people. So it's good that we're starting to have that conversation and debunk that misinformation, because it means that there's an entire generation of women who had to suffer through it without the opportunity to have HRT because of these perceived risks that ended up being overblown.
And the biggest one was the breast cancer risk, and there's no doubt every woman has that in the back of their head. It's I was afraid of it as well. But the thing is that we now have cohorts in the States where survivors of breast cancer have gone, because they make the choice and they don't like the symptoms, they've gone on hormone therapy. So they're giving us the evidence that they're doing better than the women who don't have it. And even though they've had breast cancer and are breast cancer survivor. And one other thing about that study is they used equine urine estrogen. And it was one dose for all. And we now have the biosynthetics. So it isn't even the same drug.
Yeah.
So oral health is linked to cardiovascular risk in women.
Yes.
True or false?
Women and men. So they're like, it is, which is why I feel so strongly that we should have like a national dental care program or like dental coverage, right? Because we know that it's not just the mouth. There's good evidence to show that the bacteria and the inflammation in your mouth and in your gums has been directly linked to an increased risk of cardiovascular disease and other health outcomes. So the teeth and the mouth are like just as much important part of the body from an overall health standpoint.
Tying on to that, you have estrogen receptors in your ears and in your nose and in your mouth, and we've always thought about you lose your hearing as you age, and I'm thinking maybe it's perimenopause. And I have to tell you, I went on estrogen, and I remember I was laying in bed going to sleep, and I thought, boy, that TV's loud, and I put it down, and I thought, normally I have it at a 15, and then the next night it happened again. I thought, oh my God, it was my estrogen receptors not having enough estrogen in my ears. And so all these things that, we talk about, it comes with aging. You get high blood pressure with aging in women. We see that. Guess what? There's a connection there.
You talk about going on treatment. When do you know when to phase it out? Like you say not to be on it past 60, but when do you know when your time is that you don't have to be on?
The new evidence is as long as you want to take it, you can take it. And if you think I don't have symptoms anymore, or I'll tamp down and check if I'm okay without it, then you're okay without it. There is not a limit anymore.
I know that we've talked a little bit about estrogen and progesterone, but another big topic that I've been seeing a lot on the social media from reputable sources is testosterone in women. Do you know if there's any more research being done into that? I know there's a few countries that have put out a women's dose testosterone, but more so for libido. But I hear that also it affects your fatigue levels and that as well.
So I would say, and I'm interested to hear your thoughts as well on this, Dr. Norris. So although there is like some promising information out there, like we still don't have the robust research that we need. And there's lots of people like in this transition to menopause space that will sell you things because this is like such a vulnerable space and stage of life, and wellness grifters, I'll call it out for what it is, like wellness grifters and influencers will absolutely prey on that and take advantage of people to sell them. Like testosterone pellets are a really good example. So I would say approach with caution, and if it's something that you're interested in, like please talk to your physician or nurse practitioner about it. But from my perspective, I would say the evidence still is not robust enough for me to move in that direction.
And I would say the pellets are actually dangerous because
absolutely.
we don't know what's in them and when they're getting in your body or anything like that. And so, I've heard the common 1/10 of the dose and then put it in a cream that you can use, for sexual function. But the thing is that we were working with an expert who does sexual function in perimenopause, and she's developed an online program that is cognitive behavioral therapy, because it isn't just that your tissues are dry, etc., and they need estrogen, but it's you don't feel good about yourself. You start putting on weight, and which can be changed by activity and being metabolically active. But all of those things are related. You're not sleeping, so the last thing you want to do is have sex, because I just want to sleep, thanks. So.
Sleep always wins. Sleep always wins. Yeah.
So it's actually talking about all that stuff, right? And normalizing it and saying how do we fix this? How do we make it so that you feel comfortable in your own body again?
I know we're talking a lot about estrogen, but I also have a question about multivitamins. I noticed they always offer the female over 50, and I guess it's because things are different, but do you really need that? Can you just use a regular multivitamin? Is it because you're in perimenopause, that's it? There is nothing else but estrogen? Are they
I would
effective?
argue that you don't need a multivitamin, period, at all, no matter what age or sex you are. There is very, very robust evidence to show that multivitamins, like the way that I like to phrase it, just makes expensive pee. As long as you're not eating like bread and chicken nuggets every day, you will get the nutrients that you need to support like what your body needs, with the exception, I would say, of vitamin D. Like I recommend that everybody take vitamin D, but in general, like and then vitamin D and calcium, like in, for bone health as you age, but unless you have a documented deficiency, like that you've been diagnosed with. So like if you're iron deficient, for example, if you like have had bowel surgery and you have like a malabsorptive condition, nobody really needs a multivitamin.
And that goes for a lot of the supplements too. When we were talking about, you do need a lot of protein. Eat lots.
And fiber.
And
Fiber is like the unsung hero. Like there's a lot of talk about protein, but like fiber is so much more important from like even like a cancer prevention standpoint as well.
yeah, and so we actually are going to have a video on our Aura. When you were talking about awareness, Aura stands for Awareness and Understanding of Reproductive Aging, and that's, like I said, in June it'll be on our website. But someone talking about the supplements and what works and how it works and what you should think about.
I will also just sorry, I'm like so passionate about this one. So like the pharmaceutical industry is worth about $1.3 trillion. The supplement industry is worth over $6 trillion. People want to sell you supplements that you don't need. So it's another one to very much approach with caution.
Wow, we've covered so much in an hour. I've learned so much. So you know what? I hope that you're leaving here with more knowledge, feeling more supported, feeling more confident in understanding your health and the health of your family members. And really, I hope that coming out of this session that you will now be able to more openly have conversations and support each other. I want to stop now and take time to thank our panelists for the awesome information that they shared.